For the second time in 2 weeks, residents of an HDB block in HOUGANG are getting swabbed for Covid-19 after new cases were found. A 20-year-old man has died from his injuries after PMD caught fire in a lift last night. And Singapore will tighten border controls for travellers from Guangdong after a spike in Covid-19 infections right there. You're watching The Big Story, coming to you live from the Straits Times newsroom. I'm Haryanto Dima. Now you can subscribe to the Straits Times channel so you never miss a single episode. 7 new COVID-19 cases in the community were reported today, the lowest since May 10th. 2 are currently unlinked, while the 5 linked cases had already been placed under quarantine. 6 imported cases were also confirmed today, all returning Singaporeans or PRs. Look out for more details tonight. Residents of Block 506 HOUGANG Avenue 8 are being tested for COVID-19 again after having gone through the same exercise 2 weeks ago. This comes after 30 new cases were confirmed to be linked to the block. 7 other blocks are also involved in this major swabbing drive, possibly making it the largest of its kind here to date. The test is mandatory for residents and visitors of Block 506, as well as shop employees in 7 neighbouring blocks, 511, 681 to 685 and 698. Testing for this group is being carried out at the void deck of Block 507. When our colleagues were there this morning, more than 70 people were waiting to get tested.
This is the second time doing it.
The process was totally fine. I'm used to the feeling of getting swabbed.
Second time, I feel normal. The first time was a bit scary, but second time, normal.
Today is a bit crowded compared to the 506 that day. Maybe the instruction to the hawkers at them not clear to go to the other part of there's another swab station in the open air on there. So maybe if they were told to go there, then on here will be less.
Actually, it's not a hassle at all. It's actually better because it's a precaution. It's a precautionary measure. So I don't have school today, so I'm actually free.
It's just a precautious for this COVID. In this situation, I think is necessary .
It's quite worrying because I'm pity the old age, all the disabled people at the home and there, right? I think it's quite scary for them . But for our residents, I think it's still take care of yourself . I don't feel scared because I know, this is your self-safety, so you must take care of yourself, right? If you take care of yourself and make sure that you follow everything, wear mask, everything, I think it's okay .
To be honest, my family is scared. So we take precaution measures. We don't really go out there often. We only go out to maybe buy groceries or buy food.
I think everyone need to do their parts to stay at home if needed. Don't go wandering around. If you can order food delivery, just order food delivery .
Meanwhile, residents of the 7 neighbouring blocks can choose to get tested. Visitors to these 7 blocks between May 19th and yesterday can do the same. While testing isn't compulsory for these groups, they are encouraged to get swabbed, which they can do between today and June 17th at the HDB Pavilion at Block 685A. MP for Ang Mo Kio GRC Daryl David was at the site this morning.
The site behind here is actually the COVID swabbing center that was set up by the MOH. The aim is to provide a site location for our residents to do their swabbing on a voluntary basis, of course, should they feel the need to do so. Last night, I actually went to help do a door drop. A door drop means to actually put in these pamphlets to our residents to encourage them, to explain to them what's happening, to let them know nothing to worry about. But if they would like to, if they are concerned about helping to keep the environment safe, they can come on down here to do a swab testing for themselves.
I'm happy to welcome Professor Paul Tambyah. He's a senior consultant in the Division of Infectious Diseases at NUH. Welcome, Professor. Professor, is the large-scale nature of this round of testing concerning, or does it indicate that our approach is different now in a more leave no stone unturned direction?
Well, to me, what is actually more concerning is the fact that we're still finding cases because, when we found the first few cases, they were put in isolation and their close contacts were put in quarantine. But the fact that the wastewater surveillance is still detecting cases indicates that there may be some hidden cases, and it's good that we're picking them up through this large-scale testing and surveillance. So, what is good about this whole episode is it shows that wastewater surveillance works. So if wastewater surveillance works, then we've got to make sure that we, in a way, as you said, leave no stone unturned, find all the hidden cases. That is, unless, the wastewater surveillance is too sensitive and maybe it's picking up some leftover wastewater due to some issues with the plumbing.
Right. So in the event, Professor, what is the likelihood of the second occurrence, like you mentioned, the remaining fragments that are left in the piping system?
Yeah, in general, after a period of time, when you flush through the piping system, there should not be any more, viruses left in there, because these viruses don't survive very long under the conditions that the sewage is kept. And there's lots of other, bacteria and viruses within the sewage itself. And this is a tried and true method. It's been used in Australia and Germany. And in fact, in Australia, that's how they identified the occasional cases of COVID-19. And this wastewater surveillance has even been used in Africa when they're trying to pick out polio cases. And what they do is they keep doing the surveillance, keep looking at the villages, try and find the polio cases. And then they do the surveillance until the surveillance is negative, and then they can breathe a sigh of relief.
Right. Professor, help us understand, what are the likely ways of transmission in an HDB block and surrounding areas? Now, given that we are 3 weeks into heightened alert measures with minimal socializing and communal activities and even no dining in as well.
Well, paradoxically, when we're in this heightened alert condition, where we can't go to the coffee shop and hang out or the hawker center, then we're more likely to spend more time at home, in our homes or in the void decks. And the most likely mode of transmission is through close contact in a lift or maybe in a stairwell when you're walking up and down and you bump into your neighbor. Now, there are other less likely modes of transmission. And the one I think that everyone is really concerned about is what happened in the Amoy Gardens in Hong Kong in 2003 during the original SARS outbreak, where you had multiple units, a couple of hundred individuals in 4 closely related blocks who ended up getting infected. And that was due to some backflow in the sewage. Now, at the time, we were reassured that because in Singapore toilets, they have this J-trap. So it's very unlikely that that kind of thing will happen. But the trouble is every now and again, your neighbor downstairs is doing some illegal modification of the plumbing. And so it's critically important that these things are scrutinized and evaluated to make sure that this unusual mode of transmission doesn't occur.
Professor, like you mentioned earlier on regarding the hidden cases, now do you think the HOUGANG mass testing as well as the COVID-19 task force's concern about hidden cases will have any bearing to how we proceed after June 13th, when the heightened alert period is supposed to end?
Well, paradoxically, the restrictions, actually, as I mentioned, tend to keep people at home. And if hidden cases are leading to transmission in HDB blocks, it doesn't make sense to keep people at home. What we should focus on then is the increased vaccination. Make sure that everybody gets vaccinated. Maybe if you get 1 or 2 cases in a block, you vaccinate everybody in the block. You let them jump the queue. Because, they do that for mumps outbreaks in US college campuses. So I think, I hope rather that we're not going to get increased restrictions, but rather we're getting a more targeted approach, regardless of what comes out from the screening in these HDB blocks in HOUGANG and Yishun.
I've been speaking with Professor Paul Tambyah, a senior consultant in NUH's Division of Infectious Diseases. In other local news, residents and staff at the Grace Lodge nursing home who had contact with an infected healthcare assistant have tested negative. Meanwhile, visits remain suspended until further notice, but Grace Lodge will facilitate phone or video calls. Its other measures include disinfecting affected areas and pausing other operations in the entire building until Sunday. With China's Guangdong province grappling with growing case numbers since last month, Singapore will bar all short-term visitors with a travel history to Guangdong within the last 21 days. This will take effect this Sunday, June the 6th. Singapore citizens, PRs and long-term pass holders who've been there within the last 21 days must serve a 7-day SHN at their residence. A 20-year-old man has died from injuries sustained after his PMD caught fire while he was in a lift. The incident happened last night at Block 537 Woodlands Drive 16. Members of the public used buckets of water to put out the fire before the SCDF arrived. The man was then taken to Khoo Teck Puat Hospital with severe burn injuries. According to preliminary investigations, the cause of the fire was of electrical origin from the PMD. Muslims who attended regular Friday prayers today heard a sermon emphasizing the need to treat women with dignity, honor and respect, referring to an online poll that surfaced last week, sexualizing female religious teachers. Prepared by the Office of the Mufti, the sermon also warned about the harm of victim blaming, in which women are constantly being blamed for the way they dress. Now, it said men use this as an excuse for their behavior. Looking overseas to China, where married couples are now allowed to have up to 3 children. Announced on Monday, this major policy shift replaced a 2-child limit, which was put in place in 2016, and comes after census data showed a steady decline in the country's birth rates. Last year, only 12 million babies were born in China, the lowest in 6 decades. Its population growth also slumping to the least in official records dating back to the 1950s. Growth has slowed ever since the one-child policy was introduced in 1979. Penalties for violations included fines, loss of employment, and sometimes forced abortions. The policy also led to a severe gender imbalance in China owed to the traditional preference for boys. This new 3-child policy has to undo the decades-long one-child policy, but how far will it go in tackling the heart of China's population problem? To help us understand this, the Straits Times' associate editor Ravi Vellore joins me now. Welcome, Ravi. Ravi, what did you make of China's announcement that couples are now allowed to have 3 kids?
Well, Haryanto, as you know, this came out on the afternoon of Monday, after a Politburo meeting chaired by no less than the President, President Xi Jinping. And to the extent that it reverses 4 decades of policy, you know, it started with the one-child policy announced in 1980, shortly after China went in for economic reforms, you know, opened up the economy and all that. And today, to say that, you know, I mean, where it was one child before, and sometimes quite strictly imposed. You know, I mean, there were cases of forced abortions and all that, you know, which got a lot of negative publicity for China back in the day. And to move from that position to the current, which is to say that 3 children are allowed or even encouraged, I think that is a major step for China. It's a different matter whether it will work. But to the extent that the Chinese are signaling that they want more children, could, to me, it sort of transmits a sense of worry about the declining numbers, at least the declining birth rates, which could potentially affect China in many ways.
Right. Ravi, in 2016, China allowed people to have 2 kids.
Mm-hmm.
So we had the one-child policy, and then in 2016 there is that attempt to reverse that with the 2-child policy. yet the fertility rate remains stuck at 1.3. What are the limitations to this three-child policy then?
Well, to just give you a bit of background, in 2013, the dependency ratio in China tilted, meaning that, there were, compared with the productive population, the non-productive population had tended to increase more than those in the productive age group. That was the first signal. It's called dependency ratio in demographics. And with that tilted, and China tweaked its policy at that point. What it said was, look, if the husband comes from a one-child family, if the wife comes from a one-child family, then you can have 2 children. But in 2016, they went further on that, and they said any family, regardless of whether the children were born in one-child or 2-child families, could now have 2 children. Well, it didn't seem to work because, as you said, the birth rate was stuck. The total fertility rate was stuck at 1.3. And so now they're trying to go even further down the line. But the reasons why even the 2-child policy did not work are centered in the Chinese ecosystem, principally the expenses of bringing up a child. In urban China, I think having a child and rearing a child is one of the most expensive places in the world to have a child, is in China today. And it's related to a whole lot of things, including workplace issues, the ambitions of women in China, the need for a sense of self-fulfillment, and issues like, as the gig economy comes, uncertainties around the gig economy. There's a whole lot of reasons behind it.
Right. So with that said, Ravi, then what would it take to make this policy a success?
Well, to begin with, the signaling is not bad, and I think it's a positive thing. But it has to be followed up on the ground with a whole lot of things, starting with fixing what I said, about childcare, education, making sure that a parent wants to bring a child into the world in today's China with all its attendant issues, starting with the cost of childbearing, workplace issues like HR managers, who don't look too kindly on women taking maternity leave because they don't want that expense. So I think having announced this policy, I think Beijing needs a lot of follow-up action. It could even be imposing HR policies like, maybe even insisting on a promotion for a woman who brings in a 3rd child into the world. Because, right now women are a little reluctant because they don't want their career paths to be affected by multiple child births and maternity leave and so on. So to remove the issues surrounding that would be one thing. So it's a whole lot of things that China has to do, and I think they have to start moving it very quickly to produce any decent results, because already the median age of China has exceeded that of the United States. And for China, that's a very tricky number because of this whole geopolitical contest with the United States. They don't want to be an older people than the American people, you see. So that's one small reason, and it relates to a whole lot of other things like markets, because if there are more older people, they are reluctant to spend, and ultimately that comes back into the economy's performance as consumption dips. And so it's a whole lot of things, and China, as I said, has its work cut out.
So are you seeing a more incentive-based approach?
Well, they should. They better do it.
Right?
They really better do it, because otherwise it's not going to work. I mean, as somebody said, look, I read it on one of the online posts, I'm not buying 3 Rolls Royces because the government doesn't allow me to, I thought that was a very telling quote, Right.
Well, thank you so much, Ravi, for weighing in on this matter. And that was Ravi Velloor, Associate Editor at the Straits Times. Elsewhere, Malaysia is aiming to vaccinate 80% of its population and achieve herd immunity against COVID-19 by December. With orders from Pfizer, Sinovac and AstraZeneca arriving from this month, the country's health ministry said there will be enough vaccines to cover 109% of those eligible to get the shots. And calling all muggles, the world's largest Harry Potter store is finally open in New York City. The three-story store was supposed to open last summer but got delayed because of the pandemic. And the wait was long enough for hundreds of eager Potterheads who queued for hours outside before they were allowed entry with a timed ticket. For more news and videos, visit straitstimes.com and remember to subscribe to our YouTube channel by hitting the red button below. I'm Haryanto Diman. See you next week on The Big Story.